I am optimistic, positive, and excited about chiropractic, excited about reaching people with my practice, building an exceptional life of productivity, prosperity, and generosity while being filled as a person with love, filled with fitness principles, a fitness-centered life, a longevity-centered life, and of course filled with fun. The person who can bring fun. You want to be successful? Be the person that delivers fun. You want to be liked, likability? Be the person who brings the fun. I've been known as a person who brings the fun. When I'm around, things have a tendency to get fun. Fun circumstances, fun situations, fun places to eat, fun things to do, fun conversations. My purpose is to become smarter, more powerful, capable, driven, become a superior version of myself by ever increasing my awareness. I'm going to talk about that today like we commonly do. Knowledge and understanding, motivation, hands-on skill, communication skill, and mastery in the art of exceptional living. Speaking of hands-on skill, I was teaching an event once, and oftentimes if I'm teaching an event, people will want me to adjust their C7 or T1 sitting in a chair. You might call it a Gonstead style adjustment, a Gonstead cervical chair C7 T1 adjustment. And people line up and I start to give these adjustments because they're very difficult to give and it's very hard to find somebody who can do it. Most of the time, if a chiropractor says they're adjusting C7, they're nowhere near C7. Look at their fingertip. It's not even close to C7. C7 is way down there and T1 is way down there. It's pretty much true that if you can't palm a basketball, it's going to be pretty difficult, if not impossible, to make a seated adjustment on a C7 or a T1 that's really proper, biomechanically sound and clean. Anyway, here's my point. I'm starting to give some of these adjustments. We had another gentleman at this event, and he saw me doing this, and he thought he would start doing it. And someone looked at him and said, "You do seated cervicals?" He goes, "Oh yeah, I do seated." And he sits people down, and he starts just like laterally breaking the top of their neck. There was nothing identical about what we were doing except that we were both standing and the person was sitting in the chair, but there was nothing similar. I'm on different vertebra doing something completely different, something that is almost infinitely more difficult because so few people can do it. I was at an event, there were 100 chiropractors there. I asked somebody to come up and adjust my C7 sitting in a chair. One person attempted it and it felt like they were a student and they didn't know anything. My point here is I'm always encouraging you to learn difficult techniques. They take more time. It's more frustrating. That's what causes people to quit. You don't want to be the kind of person who quits. You want to be able to do more difficult adjustments, cervical, thoracic, and lumbar. So when I say building your hands-on skill, that's what we're talking about. Chiropractic arrogance is a disease in the profession. Chiropractors running around thinking they're good. Are you kidding me? You got to get 1 million, and I'm not joking, 1 million adjustments in. And even then, like I've done around 1 million adjustments. Okay, I don't look at myself like I'm that good. If I compare myself and what I can do to what other chiropractors can do, so what? When the average is so low. Yeah, but I get good results. Those are just the people you're aware of. You don't see all the people that don't come in and can't come in because you can't help them. Let's increase our hands-on skill. I'm certainly always concerned about that. My dexterity, right hand, left hand, my foot positioning, my balance, my stabilization, cervical, thoracic, lumbar, to be really, really good at adjusting. We're going to talk a little bit about that today. It's going to be fairly interesting. I think we're going to have a lot of fun. And of course, building your communication skill. Oh my goodness, we're for sure going to talk about that today. I've got a story to tell you here I think you're going to find quite interesting. Then, of course, you're mastering the art of building an exceptional life. What's an exceptional life? An exceptional life is where you have peace and you have great relationship management. That's a topic for another day. Relationship management. In addition to having great food and quality rest and breathing great air and drinking high-level water. Having great generosity and service, and being someone that's fun to be around. Of course, every single podcast with me, Tory the chiropractor, the chiropractic practice management consultant. Hey, it causes you to naturally attract great new patients, like right now. It causes you to become more capable at motivating and persuading people. Talk about that today. Empowering you to make smarter long-term decisions. We want to win, and winning happens at the finish line, by the way. So we have to get to the finish line and win 55, 60, 65, 70, 75 with health and fitness, with money, generosity, some quality relationships intact, and with you having a good understanding of your eternal destiny. Because that's where you really win. And of course, you're energized physically, mentally, and we're energized financially. We have to have a medium of exchange to get things and do things and operate in the world. More of it's better than less of it. Might as well work hard during our working time of the week so we can have financial stability, financial health. I did a couple more of the infamous. I was going to blend infinitely famous and infamous money Zoom trainings. Had a couple on. Got into the components of the Money Zoom agenda. I felt very good. I was able to completely overhaul their life. Now they are on the path to wealth. Before, they were on the path going nowhere. And unless you've had at least 1, 2, or 3 Money Zooms with me, I'll just flat out say you're on a financial path going nowhere. You will have to work until you die. To be able to get set up on the debt elimination, the investing plan, the math behind it, the sequencing, that takes someone teaching you live on Zoom with your accounts on the screen, not just telling you about it, actually saying, go here, click this, agree to that, put that over there, set that up, getting it automated. If it's not automated in your life, in fact, let's look at it this way very quick before we get into 2 topics today. How much money do you have put away in permanent investments? How much are you automatically putting away? Automatically, not every once in a while, but auto investing into permanent investments. And just multiply that out using drcalculator.com, the simple interest calculator. Multiply that out by how many years you plan on working. You got 20,000 bucks saved up. You're saving 400 bucks a month. You want to work 29 more years. This ain't hard to figure out that you're going to be broke. We have people in Winner's Edge here. They're going to have, well, many people will have 20 million. That will be common. 50 to 100 million. Does that sound like a lot? Well, in 30 years, it may not be a lot. You have to be thinking you got to have a paid-for house and millions, plural. Are you on the right track for that? 9 out of 10, well, much more like 99 out of 100 chiropractors are not and never will be until they get the training, because it requires training. You got to be taught how to do this. I'm sure we're the only group ever in the world of chiropractic that ever packaged it in a way that basically guarantees chiropractor wealth. All right, check this out. Check this out. Two little vignettes today. The first one is this. I'm going to ask a sequence of questions. I just want you to tell me what you think the answers are. Great restaurants you like to go to, and it could be a simple place. Could be a hamburger place, a pizza place, could be a fine restaurant. Do they have recipes? Or do you go back and it's different every time? You love music. You have your favorite performing artists. They have words to their songs. They don't just wing the words every time they sing, do they? Do they have words like lyrics? Sure they do. In fact, that's why we love the song, because many times we love the lyrics and how they perform those lyrics. You have someone performing in gymnastics, they have a gymnastics routine. Floor exercise, it's a routine, isn't it? Scripted, isn't it? Football plays, do they just go hike and just wing it and everybody just runs around and the quarterback just tries to find somebody to throw the ball to? Never. That never happens. Before every single plane takes off, do they go through a checklist or do they just sit there and go, I think we have enough fuel and I think the weight is balanced. I think we'll be okay, even though I'm flying into Aspen at 7,000 feet and I've never done it before, and I'm going to have to punch through the clouds and have the runway 15 feet below the wheels of the plane and somehow know what to do. I think we'll be okay. Any sort of high-level sales presentation, do you think the person just wings it? Do you think they have an idea what they're going to say? You think high-level performance nutrition, they have a meal plan, or do they just say, let's just wing it and eat whatever we feel like eating? Never. High-level bodybuilders or people in the fitness world, do they just wing it with their workouts all the time? No, they'll have this scheduled out, what they want to be doing during the course of the week, areas they want to focus on. See, it's a matter of having a plan versus having no plan. So here's a hard question. Who wins more? People with a plan or people with no plan? Chiropractor looking to grow. Not doing that well. Poses the question to a group of chiropractors, hey, I'm not sure if I like scripting. I've seen people use scripting and they sound fake. Yeah, so that means you shouldn't use any scripting. You should just wing it with all your people and continue to not see any people and not collect any money. Are you trying to use that as an excuse so you can continue to be lazy and not sit at a desk and memorize what you should have memorized before you even opened? Just like the restaurant had recipes before they opened, didn't they? Just like the performer has memorized the script, the lyrics to their songs before they stand on a stage and perform, right? Just like the pilot goes through the checklist before they take off. Are you arguing that you're better off just winging it with your people and continuing to not grow, not collect any money, not pay any debt, not do anything of any affluence, and not be investing at all? Or are you arguing that that's the better way to go? Continue the wing it approach that's lazy and weak? Remember, in chiropractic, you only have 5 different people that you see. Car wreck or work injury, someone with Medicare, someone who has maybe a little regular insurance, someone who has nothing, they're pure cash. That's what the high performance office has. See, the high performance office can see everybody. The weak chiropractor says, oh, I only want to do cash. Why? Because you're too lazy to learn how to handle these people that just got plowed in a car wreck, or the 66-year-old woman who really, really needs you. You're too lazy to figure out how to punch a button and send in a claim. How hard is that to do? At Winner's Edge, the pro The pro chiropractor knows how to handle everybody who's coming in. That's why they're a pro. Of course, you only do 5 things. It's a new patient, it's a report, it's an office visit, it's a re-exam, it's a time to re-sign them into the future. That's it. 5 people, 5 plays. That's all we have to get good at. That's all we have to get good at. So how hard is that compared to how many plays an NFL team might have to learn? So when we talk about the concept of scripting, here's a few of the main points. There's a better way to say things than what you're saying right now. When you're standing with a new patient and you're talking, or you're doing a consultation, or how you're explaining chiropractic, or why you're taking x-rays, or why you don't have an x-ray machine, what's required for care, why kids should come in, why it takes time. There is a best way to say it that has been proven by hundreds of thousands of office visits with people all over the world. Okay? Systems get refined into what works in the trenches. Here in Winter's Edge land, yes, we just happen to have the proper scripting. In fact, if we're known for anything, we're known for like knowing exactly what to say, when to say it, and how to say it. Communication mastery, along with treatment time mastery, along with image mastery, along with layout of the office mastery, team mastery, scheduling mastery, fee structure mastery, initial plan mastery, wellness plan mastery, mastery in everything that makes the high performance chiropractic office. If that's what you want, sadly, most chiropractors don't. They don't want to be. They say they want high performance, but really they don't. I don't know where I find you. If you want to be a high performer, well, obviously you're in the Winner's Edge group. You can't say you want to be a high performer and be too lazy, weak, cheap, and stupid to not be in the high performance group. Does that make any sense? I want to be great. Well, are you a part of a group that makes people great? No. Liar, liar, pants on fire. Scripting is important because you'll forget things. It starts to get sloppy over time. You miss key words. So I've decided to accept your case. Do you have any idea how important those words are with every new patient? So I've decided to accept your case. 7 words. So I've decided to accept your case. If you miss that, do you have any idea how much it weakens you and your posturing and position relative to the patient? So I've decided to accept your case, and that is good news, isn't it? And then I get them to understand that it's good news that I decided to accept them. In other words, I take or leave you. You don't pick me, we pick you. It's very important because it gives the chiropractor power and authority, which you actually have with your decision to take or not take any patient. That's a very critical part of the script. And if you miss that with a new patient, I will promise you it will come back and it will hurt you, if it hasn't already, hundreds of times. There's a best way to say it. There's a best way to diagram it. There's a best way to answer every question. Gee, that seems like a lot of money. Compared to what? 3 words of infinite power versus, I just want to wing it because I'm too lazy to memorize any scripts. I'm happy not seeing anybody and not collecting any money and not being successful. I think I'll defend my position there. That way I can justify not actually having to sit and get any work done. All the stuff that I should have done before I even opened my office. Way to go. See, you sense this tone with me that chiropractic is incredible. It is a phenomenon. It's a phenomenon. The spine and the power, neurologically, biomechanically, it is a phenomenon. Chiropractic. The whole problem is chiropractors. Chiropractors are chiropractic's worst enemy. Always have been and are more than ever now. I did a talk for a bunch of people at Parker College the other day. And they hadn't heard me talk before, and I always find it interesting because I get on this Zoom and I see that they're all kind of hanging out in the back like they're just ready to leave once it's going to be boring like everybody else that talks. They didn't realize who was going to be talking, and all of a sudden I start talking, and then everybody's jammed up by the camera, and all of a sudden I see people walking in because everybody's texting their friends that this Tory guy is talking, the guy with the book and the guy with the podcast. My God, he's on a live Zoom. And so everybody comes into this room, and there they are packed in. As we talk about the key components of the high-performance chiropractor wanting to graduate from a chiropractic college and have a high-performance practice. And I feel for them because what they're getting is so watered down. I think that's why they enjoyed my talking so much, because it wasn't watered down. Got to put in the time and effort to be great with your hands-on skill. You've got to learn what to say and when to say it, so then you can actually get good at saying it. And that's a whole conversation for another day. You got to know your words before you can get good at saying them, right? The singer has to know the words to the song before they can get good at singing it. You have to have it down what you're going to say so you can be staring at someone in the eye who's being very critical of you and not muck it up. And this is what this one chiropractor was referring to. I see people doing the scripting and it just seems canned. Yeah, it's canned because they're no good at it. But that doesn't mean you should quit attempting to do it. It means they didn't get good enough at it yet, and you certainly aren't any good at it. And so you got to get good at it. You got to know what to say. You have to understand it's a better way to say it. Why does it take 90 days? Why does it take time to heal? Well, Jennifer, it's simply the time it takes ligaments and tendons, muscles, bones, and nerves to heal. If you sprained an ankle in a couple weeks, it's still going to hurt. But after 90 days, it's going to be pretty good. If you got a big cut that needed 30 stitches, in a couple weeks, it's going to look pretty nasty. But after 90 days, it's going to be pretty well healed. It's simply the healing time it takes for the different tissues in the human body. What is somebody going to do? Argue with you? You could say that in a courtroom and nobody would argue with you. There's a better way to say everything. Better word choices. How can I do that versus I'll never have that? Do you see the difference in those two phrases? How can I do that versus oh, I'll never have that? Words create your world. We don't have enough time to go on that, but I think you get the idea. The proper scripting for the consult, the proper scripting for the segue into how chiropractic works, your explanation of how chiropractic works, the scripting you use while you're doing a spinal examination, the scripting you use to segue into x-rays, the scripting you use as you're taking x-rays, the scripting you use if someone questions x-rays, the scripting you use to position them for the Insta report, the scripting of the problem, the scripting of how you explain your introduction to chiropractic in your office, very critical, as are all of these. Of course, the scripting, going over the plan, the scripting and the formula, as we call it, for going over the fee structure and the payment arrangement, the scripting of a perfect office visit, so you can do a lot of them. You have to know what a perfect landing is in a fighter jet before you can do it every time, right? This happens, pull this, set this, line this up. It's a script, right? Here's the sequence of events. And we want to have it be that sequence of events every time under all conditions. Of course, our scripting on our office visits with the language, our scripting and how we educate people with chiropractic, our scripting and how we prompt referrals, our referral language script, which is unbelievable once you have actually memorized it. Make it your own, your personality. There is a best way to say it. There is a best series of words to use. You just have to learn them, okay? Just like if you want to learn a song and be able to be a backup singer with a performer, you're going to have to learn the song, right? Well, you want to be a chiropractor, you got to learn the songs. The consult song, the exam song, the report song, the office visit song, the re-exam song, the re-sign song, the wellness plan song, the referrals song. You got to learn what to say, right? That's all you are as a chiropractor, what you do and what you say. Quit saying stuff that doesn't work. Okay? Learn how to say stuff better. We have it. It's not expensive to be a member. Being a Winter's Edge should be about a $4,000 to $7,000 a month thing in this modern year, but it's not. Anybody could be a member here and learn how to do things better. All right? And that's what we're committed to here for a period of time. But there's no doubt that down the road we're going to have to shut it down. Okay? And the only way to get in will be as if somebody leaves, and like nobody ever leaves hardly. Okay? Closing point on that. No script at all, winging it. Well, you'll see no people, you'll collect no real money. How could you? Then we could have, a little bit that a person worked on to learn how to say a little bit. And then a person can really know a lot of the scripting, but as soon as someone's around them, they fold. Next level would be they know the scripting and they can stand there and do a pretty good job with the patient staring at them. Next level is the person knows the scripting, they can do it with someone staring at them easily under all circumstances and handle any question that the person might ask. Have all the objection management, all of the pattern interrupt skills down. They are a master communicator, including tying in personal things for that patient and remembering their history and what's happening with their family and tying that in and making referral comments at the same time, because you know what to say. You're not sitting there trying to figure out what to say and hack at them and hope they start. You've got it down, so now you can be personable and pull in their family and their exact situation and their history. You really need to get this taken care of, Bill. Versus, Bill, you've been working a long time driving. You've driven hundreds of thousands of miles. That's compressive forces on your spine have been tremendous. So because of that, the wear and tear has you in a situation, it will take some time to repair. But of course, knowing your history, I'm sure that doesn't surprise you. Okay? Personable, tied in with them. Okay, connected because you know what you're doing. Okay, you're not an amateur. Okay? All right? Be a pro by learning what to say and then getting good at it. No laziness, no weakness, no excuses that somehow justify your laziness, no defending, sucking at stuff. Okay? In fact, anytime a chiropractor talks, they should immediately say, my name is Tory Robson. I'm at 500 visits a week and my office collects $220,000 a month. I have a question. There, now everybody knows who's asking the question. Versus, hi, I'm Jimmy. Okay, I'm seeing 90 visits a week and I'm collecting $22,000 a month. Okay, completely different scenario now, isn't it? Once a person qualifies who they are and what they are as a chiropractor. And I want who you are to increase, and I want what you are to increase as well. That is the name of the game. And to get really, really good, you have to know what to say. You have to know when to say it. You have to know how you're supposed to look when you're saying it. You have to know how to have the inflection and the tone and the pauses and the heart and the might and the care and the love to get these people to follow you because they need what you have, and that is chiropractic awesomeness. Tory out.